When you're starting your suck retraining oral exercises at home, you can just use a freshly cleaned hand. So however you like to wash your hands, hand sanitizer maybe doesn't taste the best inside a baby's mouth. If you prefer to use a glove, we use nitrile non-latex gloves, which don't have any powder or scent on them. We get ours from Kirkland's or Costco. Amazon has some great ones as well. So if you need to purchase those or feel more comfortable doing that, that's what we recommend using. Whenever you're initiating the suck retraining exercises or really any oral exercises with your baby, it's really important that they're calm and happy. So that's also speaking to you as well for the parent. If you're not in the best headspace that moment or that day, just skip those exercises for that moment. It is not worth anybody else being upset or being stressed out. So wait until your baby is in a calmer place. So if they need to be fed a little bit first, just wait until the burp break, until a little bit later on, maybe during a play session or after their diaper change. That would be a totally fine time to do these exercises. If your baby is nice and calm before they're feeding, I typically recommend doing the stretches and exercises right before they're feeding. That way they're going to have the best kind of optimal latch for that next feed. Typically, you're going to want to do your suck retrain or oral stretch exercises about 5 times a day. That can sound like a lot, but it's really just that minimum to get everything open and moving. We're not really stretching oral tethers or retraining anything unless we really get everything moving around those tethered pieces. If your little one has just had a revision, then you're definitely going to want to do these stretches at least 6 times a day, including one during the nighttime. Typically ask your provider, but about after a week, you can stop doing the nighttime stretches, but you're going to want to maintain doing those stretches during the day about 5 times. When you're doing suck retraining exercises, sometimes it's easier to be above your baby, and oftentimes it might be easier to kind of sit face to face with them. So really feel this out and see what works for you and your baby, and it might change day to day. When they're really little and they're post-revision, I'll often recommend even swaddling them so they're nice and cozy and feel really comforted during all of the exercises. So we've already talked through how to prepare your hands for the suck retraining. So then you're going to go about just getting your hand inside baby's mouth and letting them establish a nice gentle suck on your finger. Good job, bud. Once your finger is in and baby has a nice little latch or a suck going, you're going to take the tip of your finger and press down on baby's tongue. So we're going to show this from a few different angles, where right now baby's sucking and then I'm just tipping the point of my pinky down onto baby's tongue, helping to support the back of their tongue to do some pulsing. So you'll hear there's a little smack or suck for a second, and then I press down and that helps him to decrease that smacking noise. So I'm just pressing down with my pinky as he's sucking. I can feel his tongue pulsing up into my finger, and then I use the tip of my finger or my fingernail almost to press down on his tongue and give a little support. So to show that suck retraining exercise a little bit more closely, you have 2 options. When baby sucks finger in, you can press down with the pad of your finger, but if the nail feels a little too sensitive up near the palate of their mouth, flip your finger over. So when you're in baby's mouth and they suck in, you're going to slightly press down using this motion with the fingernail bed of your finger. So as baby's tongue rises up, press, press, press.